The necessary equipment for this skill are rolling gauze, splinting material, and padding material. The recommended PPE for this skill are gloves and eye protection. Once I've gathered all the necessary equipment, I'm going to direct my partner to place and maintain stabilization of the injured extremity. I'm now going to assess sensory motor and circulatory functions. Checking radial pulse, checking capillary refill of less than 2 seconds, and asking the patient if they can move their hand. Sir, can you move your hand? Yep, good. Going to measure and apply the splint. I'm going to secure the device above the injury site and below the injury site. I'm now going to secure the entire injured extremity. Going to position the hand in the position of function and reassess sensory motor and circulatory functions in the injured extremity by checking radial pulse, assessing capillary refill, less than 2 seconds, asking the patient if they can move their hand. Sir, can you move your hand?